Okay, hey, so we're gonna be talking about cancer for this one. Um, what you have to know about cancer is that in the beginning, you have to understand the risk factors that are modifiable and non modifiable, such as non modifiable risk factors include age, gender, and race, and genetic disposition. And modifiable risk factors such as drinking, obesity, smoking cigarettes, or exposure to toxins. What you want to first do is identify the risk factors and then assess the patient for symptoms such as cough and blood in the stool or lumps or any sores or lesions. And so you're going to look out for those signs. And so after assessing for those signs, you can include a lot of other things, such as implementation. So what you can do is, if you have the assessment done and get tested, and the testing, there's many tests for cancer. There's CT, there's PET, there's CBC, there's AF, no, there's CEA, there's AFP, there's mammograms, colonoscopies, pap smears. There are various other ones, which also include X-rays, MRIs, CT scans, and with the results that you get, you can understand the grade and the class of the cancer. So the cancer, you can define cancer by location. So if it's mesoderm, ectoderm, or endoderm, that's just showing that the cancer is either endoderm, means that it's in the digestive tract. Ectoderm is within the skin, and the skin and I think bones, but just the skins for sure. And then the mesoderm is going to be the peritoneal cavities and also some of your organs. So you can classify through that if it's like an endoderm or mesoderm or endoderm. But you can also classify them by grade and by stages. And by grade, by stages, you're just going to know how far the cancer has been relocated. So it's like how much metastasis has happened. And the grade, or the stages teach this, and then the grade defines or describes the cancer characteristics. So is it differentiated or is it not differentiated? And you can look into that because there are multiple stages and multiple grades. But basically, you can understand the tumor's characteristic by the grade, and you can know the metastasis by its stages. And so once you can define the location and the progression of the cancer, you can apply for treatment. And there's like multiple treatments. There's genetic treatment, there's antibody or auto or immune system treatments, or more commonly, there's radiation and there's chemotherapy. So going into radiation and chemotherapy, you should understand that the patients are going to be treated for multiple ways, but I'd like to include the fact that in the beginning, what you would want to do is provide intervention for the patient and provide them a healthy diet, provide them a good exercise routine, and tell them to get enough sleep, because these are the three things that are most important to intervene with the cancer. And lastly, you want to know your family history to know how much of a risk that you have for having cancer. So having all these physical exam or physical or like, having considered your nutrition, your exercise, and your sleep, you can further progress the treatment with more aggressive ways to battle the cancer. And so one of them is radiation and the other one is chemotherapy. And with chemotherapy, what you want is to understand that there's chronic and acute symptoms of having chemotherapy. And so chemotherapy is given in three different services. There's palliative care, there's control care, and there is controlled and cure. So basically, you do chemotherapy to either cure the person of the cancer or to control the progression of the cancer. And cancer never goes backwards; it always goes forward. Or just alleviate the symptoms of the cancer and try to give the person, a good ride, or like less of the symptoms to alleviate the condition of the cancer. And so there's three ways you can give cancer therapy, which is, and then there are three, and then there's two different side effects. And we go into radiation. And radiation is important for multiple ways, but you need to understand that for radiation, you need to know the depth of the tumor, and you also have to know the size of the tumor so that you can promote the radiation according to how big the cancer cells become and how deep it's gone into your tissue. And so you can have multiple radiations like alpha, and there's also gamma rays. But what you need to understand is there are multiple ways to give this chemotherapy, and also chemotherapy, there's medications for radiation. There's radioactive medications that you can take to service chemotherapy. And one thing that I forgot to mention before was that there's CT scans, but the CT scans, MRIs, and X-rays, and mammograms, and colonoscopies, and CT scans, colonoscopies, they're great methods to measure or assess the cancer cell. But the number one way is biopsy, and there's three different types of biopsies. But basically, biopsy is just removing the cancer cell and sending it to a lab, and that's basically it. And so we come back to the palliative care is not only includes chemotherapy, but it also includes making sure that the patient's bone fracture or bone is restructured so that it's strong enough to withhold the therapy so that they don't get any broken bones in the process. And so you also want to put them in nasogastric feeding tubes. And lastly, you want them to be set up with a direct central line and not a peripheral line, because the central line is when the chemotherapy drug is administered, will prevent certain side effects, such as like scars, or not scars, but lesions of the skin, because a peripheral line will cause that, but a central line wouldn't. So knowing that there's different types of cares, and there's different ways to treat there's different ways to treat cancer with chemo and chemotherapy and radiation. But you want to also note that there are going to be side effects. Chemotherapy is injected through the blood vessels, through the arteries, through the bladder, and through direct injection of the drug into the cell. And so what you want to do is assess the bladder and the kidneys for any side effects, because these chemotherapy drugs are toxic to the kidneys and would affect the bladder as well. And you want to also be assessing rapidly dividing cells, so like the skin, the hair, making sure that there's no scarring, no sores or lesions. And lastly, you want to check the person's digestion, because the digestion might be impaired because of the toxicity of the chemotherapy drugs. So there are other ways to treat for chemotherapy, to treat for the cancer besides radiation. Like I said, there's the immune system, and there's also the genetic way. You can also treat them with gene therapy. But that pretty much concludes the cancer segment. I wanted to mention how when someone has cancer, you want to make sure that they allocate time to rest and they adjust their diet so that they can properly treat for cancer. And yeah, that's about it. Those are all the points that I wanted to mention that I learned about cancer therapy and cancer. And I hope that this was educational for you. Thank you.